In the following video, we will demonstrate the same technique but using total assistance. With the help of Sean, we will perform a forward-backward weight transfer to bring the patient back up in her bed. So first of all, we're going to lower our side rails, and we're going to remove the pillow from under the patient's head and position it at the head of the bed to prevent injuries. Now, in terms of positioning, we will each be facing the opposite corner of the bed to facilitate the movement. We can ask the patient to cross her arm on her torso to give us more room to grab onto the PK. To grab onto the PK, you can roll the upper corner and have a firm grip on it, palms down, to prevent injuries to the wrist. Now again, we position ourselves for forward-backward weight transfer. So at the beginning of the movement, all of our weight is on the front leg, and as we perform the movement, we shift our weight backward. In terms of arm positioning, the elbows have to be slightly bent, and they must remain slightly bent throughout the movement. One thing to avoid is to pull on the PK and bending the elbow because this puts us at risk of injuries. So we're grabbing onto the PK, facing the opposite corner, and Sean, on my count of 3, we're gonna go up. You ready?
Yes.
Okay, so 1, 2, 3. Okay, so now again, very important, the elbow kept slightly bent, and we did not pull the patient with our arm, but really with our whole body weight. Now we're gonna reposition the patient's pillow. Is this a comfortable position?
Yes, thank you.
Perfect. And before leaving the room, make sure to put the side rails back up.